Hi, it's Gina Grad here again. Now, the person who makes LDI so successful is Dr. Jacob Rispler. Dr. Rispler is certified by the American Board of Dermatology and has helped tens of thousands of patients in over 33 years. He's a pioneer in this industry and he loves working with patients, and we're very lucky to get to talk to him now. Hi, Dr. Rispler.
Hi.
Thank you so much for talking to us. So first, can you explain what exactly a laser is?
Well, laser is an intense form of light.
Right.
But it works much better than those IPLs, those cosmetic IPLs that are out there. And the lasers have been out since the 70s, but new applications in the last 5 years has really revolutionized the treatments of many skin diseases, especially acne,
Right.
and improvement of acne scars.
Is there anything else that the lasers are good for, like wrinkles or that sort of thing?
Well, they do help remodel the collagen. So if there's scarring, sun-damaged skin, a lot of people do get these bumpy, oily skin as they age.
Right.
Also helps with fine lines and wrinkles. Then we have the QYAG laser, which works on not only pinpoint acne scars, but helps pigmentation. A lot of our Southern Californian patients, especially those that hail from Central South America and all the darker skin zones, have a lot of problems with pigmentation. The pulse dye laser works for our light-skinned Irish, Scotch-Irish patients that have the red noses, the red faces,
Right.
and the red acne scars. But most people just don't have one or the other. They have combinations. So you really have to use multiple different lasers. And that's where we're unique. Most of the facilities, even the medical facilities, the doctors maybe will own one laser. Over 90% of the dermatologists don't own any lasers, and the other 10% may own one. So we have over 30. We have some duplicates. And I'm not saying we use all 30 at the same time, but we have the option. So we have all the different things. Some will work better around the eyes. Some lasers work better for acne around the mouth.
Right.
And then we have the newest laser, which is the fractional, the computerized CO2, which actually works very deeply on sun-damaged skin, on acne scars, reduces oil gland inflammation, and actually will tighten the skin and roll back the years.
And I can say personally, from having used it, I'm a huge fan. It's worked very well for me.
Well, on the women that are between 25 and 40, and men too, we can hit a home run, which means we can reverse 100% of the sun damage, improve the acne scars 50 to 80%. On some of the older patients like myself, I turned 61, but I've cheated. I've had a couple of these lasers that really removed a lot of the wrinkles, and it gives us a very nice natural look. Over 50% of our patients are males because you don't have to wear any makeup. It's not plastic surgery. It doesn't change your facial skin structure. It just rolls back the clock, so we can go head-to-head with what the plastic surgeons are offering in a very safe, natural, and relatively inexpensive way.
I know that some people might be afraid that it hurts or it's very painful. Every time I come in, it is completely harmless. It might be a little annoying or it might, jar you for a second if you're not used to it, but I've never considered any of my treatments painful. Can you speak to that a little bit?
Well, they've introduced some new ways of cooling the skin.
Right.
So most of the lasers will have cooling sprays, so you don't even feel it. The non-ablative lasers, the lasers that stop the acne, reduce inflammation, you don't feel at all, and it's even FDA approved for children as young as 2 weeks of age for their birthmarks. The laser that stings the most is the fractionalized CO2, and you need some topical anesthesia, some local numbing ointment. So we don't have to use any needles, and there's no drugs, and everybody's able to walk out of the procedure and go right home. There's no after effects, like no general anesthesia.
Right.
And which also keeps the expense down and makes it very, very safe.
Well, and there's no downtime. It's not like, I have to sort of check myself into an anonymous motel for 2 weeks while my skin heals itself. It's pretty safe and pretty easy.
80% of the lasers, there's just maybe a couple hours of redness.
Right.
For the fractionalized CO2, there's a couple of days of what we call social downtime. It looks like a bad sunburn that's peeling, but you can go along with your daily activities.
Right.
So really, there's no bandages and no swelling.
You're not going to wrap me up like a mummy. No.
Right.
Okay. Now, I can tell you firsthand, and I know a lot of your patients can, that I have tried everything that's on the market. I have tried creams and ointments and pills and everything, and nothing gave me results. In fact, a lot of those things irritated my situation even more. So that's why I'm really, really lucky that I found you, because the lasers completely eliminated everything, made all of the acne vanish, all of the eczema vanish, made everything go away, even the wrinkles were reduced, and I didn't have to go back to the drugstore, and I didn't have to go back to other dermatologists who, frankly, I just don't trust as much as I trust you. So first of all, thank you for that. So why is that? Why don't those products work as well as this?
Well, we the treatments really are not very effective for acne. I mean, other than very mild acne, which people outgrow and don't get scars, for the subset of patients that have severe acne and scarring acne, even the prescription medicines don't work.
Yeah.
The only prescription that has a partial effect is Accutane, but that's a very toxic drug, has a lot of side effects. And the lasers actually work better than Accutane because unlike Accutane, when you take it, it causes scars. The laser, while it's clearing up the acne, improves the scars.
Unbelievable.
And we use some minor products and washes together with the laser, but the laser does 90% of the work. And it's a permanent effect. It reduces inflammation. For example, I suffer with eczema too, and we use a lot of cortisone-based creams.
Right.
So the cortisone-based creams are dangerous,
Yeah.
and they reduce inflammation temporarily, and actually there's a rebound effect. While when you use the extract laser, for example, for severe eczema, you actually reduce the inflammation, you reduce the blood vessel thickness permanently, so you get a permanent-like effect.
I know that people get a little nervous about, oh, how much is it going to be, and is the cost going to be too high for me? But the one thing I can say, hands down for sure, the money I have spent on everything from stuff you get at the drugstore, which is not cheap, to things that have been prescribed to me by other dermatologists, and none of that stuff was covered by my insurance. That was all out of pocket. That at the end of the day, I ended up saving so much money doing laser surgery because it's more permanent than I did wasting so much money on products that I'll never use again. I might as well just flush them.
Plus, the medicines don't work on the
Right.
scars. So you could spend thousands of dollars on Accutane
Yeah.
for the cost of the medications and the lab tests, and you're still going to have scars. Yeah. And the nice thing about the laser is we can do it in areas, so we can really keep it on a budget and yet have a really good effect.
Like you said, if it's for my driving sunspots right here, it's not something that's going to affect my entire body. It's something
Right.
that's going to affect the damaged area.
Right, so we can work on cheeks, we can work on the chin area, we can work all over the face, we can do large backs, yet we can do a small part of the back. So lasers are pinpoint technology.
So great. Well, thank you so much for taking the time to talk to us. I know you're very busy here, but we really appreciate you clearing all this up for us and making it a little less scary. Thank you so much. And if you're interested in a free consultation, go ahead and log on to www.laserhq.com or call the 24-hour hotline at 1-800-606-6000. See you soon.